So I think this was a very interesting meeting that we had today, in which, if I can draw a simple line, uh, I can say that the technology, when we get to digital medicine and its application, is not an issue, it's not a barrier, it's not a challenge anymore. Technology is there. And we have been following the presentations one by one, and there is no issue as well in the potential application of technology. We have been hearing from top managers of big pharmas. We have been hearing from top managers of digital medicine companies. So I think this is now clear. Technology is out there and ready to be implemented. Of course, when it comes to implementing new technologies, there are other types of barriers. And I think we heard from Giuseppe Recchia quite systematically, even if into one single country scenario, but it can be representative of the overall situation, that barriers can be at the acceptance level by the regulatory system, and further on the field at the acceptance level by national health systems, which is the same to say by payers. So we have structured this roundtable to be as interactive as possible. So I would like speakers to keep their presentations very concise and sharp, to leave some space for discussion. And of course, I encourage the audience to post as many questions as you want. Even during the presentation, we will try in between presentations to discuss about the questions. Unfortunately, I have to report that our first speaker, Vincenzo Palermo, who is the Oncology Vice President from GSK Italy, for a personal situation, he cannot be with us. And we concurred with Vincenzo that he would have triggered this round table with a specific stimulus. So Irida, if you can show the slide that Vincenzo had prepared for us, maybe I can go through it and we can start the discussion from there.
Of course, give me a minute.
Yes, a minute is too much. A few seconds. I'm joking. Okay. I think that if we look at this slide, it summarizes a bit, even if in the field of oncology, and we have been seeing that the oncology is not the only sector in which these things can be applied, these new technologies can be applied. It is clear that if we can solve the barriers by means of applying innovative digital solutions, we can give relevant support in all stages of care. Buzzword this time is the support to the patient journey, end to end. As a clinical oncologist myself, as a surgical oncologist, I know that the journey of the patient only starts at the moment he or she is treated at the hospital, but the real journey starts from that moment onwards. And fortunately, in this period and in the year to come, and potentially in the next 2 years, many treatments will be available that are based on the assumption that treatment can be prolonged for all life long. So we are in a way breaking the paradigm that you get a treatment for a certain period and then you get a follow-up with no treatment and then another treatment. New molecules are hitting the market, and these molecules allow for chronic treatment, and this is expected to have a huge impact on significant endpoints, especially in oncology. This sort of approach, of course, triggers new questions, triggers new challenges, because any treatment brings toxicity. Any treatments brings adherence issues. So the digital support to all of this can really solve these problems. So if we give this as the starting point of the discussion of this roundtable, you will see, while I present the speakers, that we will try to understand if the application of these solutions and how the application of this solution can be eased, can be facilitated in a way. And we will hear the perspectives of who is in charge of putting in place validation pathways for new technologies in the market, to arrive to the end with the voice of a patient, so that we can close the overall fil rouge of the meeting by really bridging the technology through the regulatory and national health systems acceptance and payers acceptance, finally to the patient, to the benefit of the patient. So we will try to see how these players see this bridging that we have been discussing on up to now.